Hello, everyone. I'm Kelly Lenvoy, and welcome to another special episode of Arthritis Consumer Experts #CR Arthritis series. Today's guest is a good friend of ACE's, and that is Michelle Bridge, who's an advanced clinician practitioner in arthritis care, ACPAC-trained occupational therapist, and current president of the Arthritis Health Professions Association. Michelle also serves as member at large of the ACPAC Special Interest Group leadership team. Michelle, welcome back to the show.
Thanks, Kelly. Thanks for the warm welcome. And I'm happy to be back. It's truly an honor. ACE does such important work in educating and advocating for people living with arthritis. So I'm honored to be a part of this conversation. Thank you.
Thanks, Michelle. It's very nice of you to recognize that. And I think at the outset of our conversation, I'd like to recognize and maybe elaborate on a couple of terms, descriptions that we used in your bio. And that is, first of all, the Arthritis Health Professions Association, otherwise known as the AHPA. Can you tell us a little bit about the association that you're currently the president of and the work that you do?
Absolutely. So we are a dedicated group of health professionals, students, trainees, researchers, and administrators from across Canada who are really passionate about improving the care of people with arthritis and related diseases. So we're really aimed at building and sustaining this community of professionals in order to provide the best possible care to Canadians with arthritis. And we do this through knowledge translation, engagement, and interprofessional collaboration.
Now, those arthritis health professionals that you're describing are key members of an arthritis patient's healthcare team. Can you describe or tell us who or what some of those professions are?
Yeah, of course, we accept all non-physician healthcare professionals working or interested in arthritis care practice. So this can include, but of course not limited to, occupational therapies, physiotherapists, dietitians, kinesiologists, nurses and nurse practitioners, pharmacists, social workers, and psychologists. And we think that it's very important, to have this strong community of various health professionals because arthritis care is not just about medical management. Arthritis impacts daily function and mobility and mental health and overall quality of life. So our clinician members really help with providing that hands-on care, education, and support to help people with arthritis to live well, stay active, and of course, manage their disease effectively.
Now, Michelle, you yourself are an ACPAC-trained occupational therapist. I'd like you to describe to our viewers and listeners what ACPAC is. So if we're talking about extending the role of some of those arthritis professionals that you've described, what does that include?
Yeah, sure. So ACPAC, again, Advanced Clinician Practitioner in Arthritis Care, is a training program. It's hybrid academic and clinical training, and it really helps to prepare these select and experienced therapists, physiotherapists, occupational therapists, as well as chiropractors and nurses for these extended practice roles, which would then help with the diagnosis and management of patients with not just rheumatic diseases, but we also have a lot of ACPAC professionals working on the orthopedic side as well.
Mm,
So arthritis and musculoskeletal conditions.
mm. And where would we find ACPAC trained clinicians in Canada operating?
Yeah, we are spread out throughout the whole country in various provinces. And most of us, though, I mean, the training program is in Ontario. So most of us are centered in Ontario.
Okay. Now, at the annual scientific meeting, you're participating in a session titled "Closing the Gap Between Primary Care and Rheumatology: The Rheumatology Rapid Assessment Clinic Model." What is this model? And I understand it's designed to help patients get faster access to care in remote or underserved communities. How does it work?
Yeah, so we've termed it the Rheum RAC, so Rheumatology Rapid Assessment Clinic. And the way that we operate through Arthritis Society Canada's Arthritis Rehabilitation and Education program is that we look at it as a streamlined model of care, really designed to improve access to timely, specialized care for adults with suspected or active rheumatic disease. So basically what happens is, a patient presents to their primary care provider and they're suspicious of a rheumatic disease. So they make the referral to our program. And then so our program through the Rheum RAC, the services are delivered by occupational therapists, physiotherapists practicing in the extended scope, so certified as ACPAC, as we just discussed. And we really do provide a very comprehensive assessment, recommendations on appropriate diagnostic tests that then lead to helping us with making a triage decision. And in the cases where we are suspecting it could be a rheumatic disease, then we facilitate that referral to one of our partnering either local, remote, or telemedicine rheumatologists. And so effectively, we're building on established trust and reputation with our partnering rheumatologists because we already have kind of background work with them. And in Northern Ontario, our therapist travels to various remote and underserviced communities to offer these services. And not only do we focus on the triage component, but also we're providing education and support and referral to appropriate community resources too. So we're really able to expand our reach by using kind of like that hybrid approach where there's a mixture of both in-person and virtual visits.
That's incredibly important work. And I'm thinking, of course, for people living with inflammatory arthritis, such as rheumatoid arthritis, psoriatic arthritis, lupus, ankylosing spondylitis, really serious, complex chronic diseases that require timely access to referral, as you mentioned, to diagnosis, as you've mentioned, and to treatment and care is really, really critical, or else those people can get really, really sick really, really fast. This is a really important component in terms of the models of care for those people. What sort of results have you found from this model, from this intervention?
Yeah, well, I mean, we are definitely expanding the capacity of the healthcare system. We're streamlining patient pathways. So basically, like I said, we're providing the early assessment and triage. So patients get to see us sooner than they get to see a rheumatologist. So, there's the time frame there. But then also we're facilitating the appropriate diagnostics. So we're working with the primary care provider to order diagnostics that or investigations that not only help us with our triage model, but also to help with that would be baseline investigations anyways upon first visit with the rheumatologist. The idea is that I'm trying to facilitate those earlier interventions. So I try to package my referral to the rheumatologist so that they can diagnose and treat on the first visit rather than, having to delay again and ordering more investigations and so on. So essentially improving time to medical management and theoretically reducing joint damage and disability. So I really think that this shared care approach ensures that patients living with arthritis receive we like to say, receive the right care at the right time by the right person, and ultimately improving patient outcomes. And our metrics are showing this. So it's wonderful. It's phenomenal, actually.
Very exciting, incredible impact for patients and for healthcare outcomes. And obviously, ACE supports you every which way that we can. Finally, maybe you can talk to us and our audience about the AHPA and some of the programs and initiatives that are currently underway in 2025.
Yeah, sure. So I like to kind of divide it up into our strategic priorities. So we focus on the knowledge translation, engagement, sustainability. And so with regards to the knowledge translation, every year we have our annual AHPA pre-course. So this year we just concluded our 17th annual pre-course, but we're doing things a little bit different this year, and we're adding on a post-course too. So this is post Canadian Rheumatology Association annual scientific meeting. So we have planned this to be on March 22nd. We're hoping to finalize our agenda this week while we're at the ASM. But so there's that we have looking forward to. Then obviously we also have to kind of sprinkle other educational webinars throughout the year for our members, really helping to equip them with tools to support their patients that have arthritis and related diseases. And then on the engagement side of things, so we send out bi-weekly newsletters to our members, and this provides them with updates on our strategic initiatives, our upcoming internal and external events, our networking opportunities, different job postings and grants, awards, research advancements, member spotlights. It includes kind of research recruitments and resources and scholarship opportunities for our members to share with their patients. So it's one way that we're able to translate what's happening in our partner relationships, because we're partnering with patient organizations, professional organizations, research organizations, so we can effectively communicate what's happening with our partners through this means of our biweekly AHPA news to help our members stay informed and connected and involved in the AHPA community. And then another one of our engagement initiatives would, of course, be our involvement with the Arthritis Action Plan. So I represent AHPA at the Arthritis Ecosystem Champions meetings, as well as I co-participate in the Awareness and Advocacy Working Group. And so, as you're fully familiar, this plan is set out to really revolutionize health outcomes and quality of life for patients living with arthritis. So that holds near and dear to my heart. And then on the sustainability, a pillar of our strategic plan. Of course, we're continuing to work to build our resources, our organizational structure, our capacity to achieve our goals and provide excellent value to our members. So really, I guess what's important to communicate here is that all of our initiatives we undertake. They are driven by our vision of optimal care and quality of life for every Canadian living with arthritis. So this really ensures that our efforts support healthcare professionals and researchers and administrators in delivering the impactful care and advancing research and improving outcomes for those affected by arthritis.
We salute the HPA and all the work that you do, truly. And we are going to provide links at the end of this episode to some of that programming that you're talking about. I also want to say that on a personal level, ACE is always excited to be able to talk to, the future next generation of leaders in the arthritis community. And Michelle, it's always a real pleasure to be able to spend some time with you because you are one of those next generation leaders. And I just want to thank you for all the service that and leadership that you're providing the community. So thanks very much, and thanks for
Thank
joining us
you.
today, Michelle.
Thank you so much. I appreciate it.
And to everyone watching and listening, thank you for joining us and hope to see you soon again for another episode of hashtag CR Arthritis as we share more key takeaways from the presentations at the CRA's annual scientific meeting. Goodbye for now.